Hello, my name is Jaesung Lee in Wine Plastic Surgery Clinic, and I'm going to briefly talk about the basic concepts of skin boosters and then focus on one of the most potent components, polynucleotides. These are a list of contents. In 2023, the global market size of skin booster exceeds $1 billion, but the history of skin booster is less than 10 years, still making them quite new and fancy items. There are also estimations that the annual growth rate will be nearly 10% to 2030. Currently, there are various skin boosters with different components. Each has differences in strengths and indications, and some are injectables and the others are not. As you can see, there are numerous options available, but the most versatile and easy to use injectable component would PN. In fact, according to a recent study, the most widely used skin booster among Korean dermatologists was PN, with 88% of them. PN, as deoxyribonucleic acid fragments, performs various biological functions. Compared to PDRN, which has similar characteristics, PN has longer nucleotide chains and higher molecular weight, and it has distinct three-dimensional structure, which allows it last longer and provides structure support. The mechanisms of PN have been identified and listed, such as anti-inflammatory properties, repair the damaged DNA, and increase collagen and hydrating skin. The paper that I mentioned includes survey on indications of using PN. These indications can be broadly categorized into fine wrinkles, general skin conditions, and specific disease or conditions. As you can see, PN is not only used for cosmetic purpose, but also for subjective symptoms or some disease like rosacea and melasma. Additionally, it is also used for a range of areas such as atrophy, scars, and hair loss.
How many sections this one before atrophy? The 8 section?
Oh, no. It is for reference.
8 section.
No. Reference. Maybe the session, maybe the paper said that they inject less than 0.1 cc about 8 times.
8 times?
Yeah. While injection, the most important thing is the depth. This intradermal injection is most effective way to deliver active ingredients into dermal fibroblasts. Due to the depth of injection, these bumps or embossings are made and may last up to several days. The dosage and interval may be varied depending on patient's condition and subjective goals. Some insist that using 4 cc for full face treatment is sufficient, but in most of cases, it is often necessary to use 6 cc to cover full face. In our clinic, we sometimes use more than 12 cc in a single session to cover entire face and neck. Typically, the procedure is performed 3 times to 2 to 4 week interval and is repeated every 6 to 12 months. According to the purpose, the other skin boosters like botulinum toxin and hyaluronic acid can be added. It's also acceptable to use energy-based device before or after treatment. Some people claim that energy-based device can help reduce these bumps or embossing.
So I think we must do like this injection because of the botulinum toxin. I think we can do very superficial because of the botulinum toxin.
Some call is.
If we can do the deep injection, there's a problem, I think, because of botulinum toxin.
I'm sorry.
If we make with this product the deep injection, we can see some problems because of the botulinum toxin.
No. I'm sorry.
Now we must use this product very superficial, the updermis. If we do the deep injection, we can see some problems because of muscle, because of botulinum toxin. Is it true?
If injection.
İçeriyor mu?
Öyle
Doğru
değil
doğru
mi?
öyle oluyor.
If you inject botulinum toxin in intramuscular layer, the botulinum toxin.
These
No, no.
products include the botulinum toxin, right?
No, no, no.
Hayır diyor ki bunu
This is composed only polynucleotide.
If you want, we can put botulinum toxin.
You can add, but
But you say botulinum toxin.
to
Could you ask the question again? Could you ask the question again?
I think 3 or 4 minutes ago, he said that the botulinum toxin include this one, or we can put this.
No, it's a combination.
I see. Well, actually, in Korea, we call it Skinbooster or dermatoxin technique. We inject botulinum toxin very
This is different
superficially.
botulinum toxin or derived botulinum toxin. It's different.
지금 뭐라고?
I did.
Ya botulinum toksini bir tek ben mi gördüm ya?
Hayır yazıyor şu işte. Kombinasyonda yazıyor zaten.
Actually, I,
Mezobotoks tarzında kullanılabilir.
Ama içine koyuyor galiba değil mi?
separately. Yes. Actually, 우리 보통 따로 하죠.
Hayır içine koyuyor değil mi?
Yeah.
Ya,
Actually, separately. Yes.
Kombinasyon şey.
Definitely separately.
Yani eğer siz botoksta kullanırsanız daha faydalı olacak ama ayrı.
Sinerji.
Then,
Evet.
is it clear then? Yes. So you may know the dermatoxin technique, right?
Yeah.
Yeah, we inject the toxin very superficially on superficial dermis level.
Ha içine koymuyor ayrı ayrı. O zaman onu
Yes.
söyleyeyim. Neyse okey.
Yeah, we apply them.
Okay.
As you can see, some use PN alone to improve facial fine lines, but some can add botulinum toxin or some can add hyaluronic acid to improve facial fine lines.
Kombinasyonlarını
Yeah, it's like combination. There are various types of PN formulations, and the 2% is generally the highest concentration. And as mentioned earlier, it can be used all of the areas of face and neck, and for almost any purpose. It can be used also on the back of the hands too. These are references of this lecture, and thank you for attention.